Welcome to Data Fest Africa 2024, Day 3. A round of applause for Jeffrey as we bring him off stage.
All right. So my name is Jeffrey. I'm a medical doctor and an AI expert. The lead researcher for SabiYarn, Nigeria's first decoder-only language model that could handle multitasks in several Nigerian languages. So today I'm going to be talking about how AI is transforming healthcare. But not only that, I'm also going to be talking about the ethical issues facing AI's integration into healthcare, and the challenges that affect the adoption of AI into healthcare. We had a similar session yesterday, so I'm going to be taking a different approach, and I'm going to be dwelling more on the ethical considerations facing AI's adoption into healthcare. All right, so let's start. Next slide. So AI in health represents not just a technical advancement, but also a paradigm shift. We are looking at a sector where we are moving from a sickness management model to a patient awareness model. We are moving from a sickness model to a well-being model. Next slide. Yes, and the reason why this is important is we'll start to see that patients are more proactive about their health. They want to know what's wrong with them, and that way they become more satisfied and they're more likely to comply to any management plans given by any healthcare provider. Next slide. Okay, let's do just a little bit of statistical study here. In 2022, it was predicted that AI in healthcare market would reach a $502 billion valuation. It's a high figure, very suspicious, but that's what it says. About 20% of healthcare institutions are already integrating AI solutions into their institutions. And as we all know, AI is currently fast-tracking the development of new drugs by 70%. I have a plot here that shows the impact of AI on healthcare outcomes before and after AI. And what you will see is that there's a 10 to 50% increase in efficiency in several very, very important factors. Like the drug discovery, you see about a 50% improvement before and after AI. You will see a 50% improvement in the cost of treatment of patients before and after AI. Next slide. So what are some of the exciting advancements happening in the different fields in different medical fields that we know? Next. First, we have predictive analytics and risk assessment. Here we have models that currently exist that can predict the likelihood of someone getting a disease by studying the person's genetics, studying the person's lifestyle and environmental factors. And this has been responsible. We've been able to use these models to predict the prognosis of 27 out of 35 cancers well known in the world. Next slide. Yeah, we spoke about drug discovery. So AI is currently cutting the time and the cost of making drugs by predicting potential candidates. But not just potential candidates, we are also looking at prediction of clinical safety, side effects on patients. And this is very important. As we saw in the year 2020, where we had COVID-19, we were able to develop a vaccine for COVID-19 so quickly because there were models that were going through vast amount of data, especially for viruses very similar to the coronavirus. Next slide. AI in surgery. We now have smart robots that can perform basic surgical tasks like stitching. In 2016, there was a smart robot that was developed that successfully stitched a pig's intestine and outperformed human surgeons in that field. Now, while this might be fun and great, please do not give any of your body parts to any smart robot for surgeries. Next slide. This is a very, very important one. We have AI in psychiatry. There are models currently being made that can predict suicidal risk by 90 to 92%. And there are also models that can predict the stages of depression and anxiety by just listening to a patient's voice or analyzing a patient's text message or looking at a patient's facial expression. I was opportune to be part of one of these projects, and it was a really great experience. Now, having said that, I would like to let everyone know that if you or anyone in Nigeria is thinking about ending it because of the current economic situation in Nigeria, I would just like to let everyone know that I have these models and I'll be watching you. I will be watching you. In case you think of committing suicide, I'll be there to watch you. All right? Next slide. Next slide. Okay, here are some other advancements in some other fields. The most notable one here is the forensic medicine. We have 3D convolutional neural networks that are being used to predict the age, the sex, and the facial representation of corpses. These models can also predict the most probable murder weapon used during a murder case. Next slide. All right, so we've spoken about some of the advancements in the medical fields, but how is this AI innovation actually helping patients? What are the real world examples of how this AI is helping patients, right? It does this in two major ways. The first way is we bring the AI health solution closer to the patient. The second way is that we personalize management plans for patients. Next slide, please. So the first item on the list is personalized treatment plans. Models can now analyze patients' data, like I mentioned before, including their genetic data, and come up with personalized management plans for them. Well, how would this help the patient? It will help the patient because we would have patients being more satisfied and more likely to comply with any drug treatments that has been given to them. Next. Mental health support. There are currently AI-driven health platforms that analyze people, analyze the mentally challenged, check out their engagement levels, perform preliminary reviews, and also act as companions. So you could be on your phone and you're talking with a companion, you have a drug addiction, and you're just speaking to this companion about your problems, and it's there for you 24/7. It is analyzing your engagement levels. It is also analyzing your risk of relapse. This is really amazing. Next slide. We have predictive analytics on wearable devices now. Now, thanks to this technology, we are able to collect biological data from patients in their houses. They don't need to come into the hospital. Why is this important? It means that if I have a wristwatch, I could collect vital signs, I could collect your pulse rate, I could collect your respiratory rate, I could collect your sleep pattern, right? I could collect so much from just a single smart wristwatch. And what this would allow me to discover is it can help me predict any early deterioration in your clinical status. So I don't need to wait till you have an emergency. I could be more preemptive and figure it out and then intervene earlier. Next slide. AI is not just helping patients at home, it's also helping the healthcare providers. How? By streamlining administrative tasks. We have AI models being used to organize staff scheduling, inventory management, and also to organize patient flow in the outpatient setting. How does this help the healthcare provider and the patient? Well, for the healthcare provider, it enables the healthcare provider to focus on the patient, right? You focus on the patient. And for the patient, it reduces the wait time in the clinic. So a patient comes into the clinic by 9, he sees a doctor within a short period of time, and he can go home. There's also the use of virtual assistants in healthcare. So many apps have been developed with virtual assistants embedded in it. And majorly, the most common use of virtual assistants are to answer simple queries, simple medical questions. You have a symptom, you speak to the virtual assistant, it gives you an answer, everybody's happy. And this is really good. Next slide. There's also the use case of robotics. Now, in this use case, we are seeing robotic care providers actually helping the aging population by performing routine tasks like lifting heavy loads and transferring them. Robots are also being used in dispensing medications in the healthcare facilities. Next. So we've spoken about some of the advancements for both patients and hospitals and healthcare providers. Next question is, how do we balance cutting edge innovation with ethical considerations? Next. Well, as AI tends to take a more important role in clinical health decisions, what we see is that we need to maintain public trust, we need to maintain patient trust and patient safety. So the first issue we would face will be bias and fairness. We have AI models that can amplify any bias found in data. Transparency and explainability is very important. If AI models are treated as black box, then healthcare providers will be reluctant to use them. Why? Because they don't understand how it arrives at a particular clinical decision. Patient privacy and data security. As we expose AI models to more of the patient data, we have to worry about this because there are sensitive data being contained in this patient's information that we don't want to be let outside. Informed consent. Informed consent is very important because we require that patients maintain autonomy. We want patients to be able to determine if they want AI models to help them or if they don't want AI models to help them. Human oversight. Whilst AI technology is really good, we want clinical providers to maintain full oversight over these agents. So the AI technology in itself should be treated as an assistive technology. Liability and accountability. Here we have a very complex ethical and legal landscape. So, for example, an AI makes a decision that leads to the death of a patient. Who is to be held responsible? Do we hold the AI responsible, or do we hold the healthcare institution that integrated the AI responsible? For this, we would need to set very, very important, clear clinical guidance that explain the roles and responsibility of everyone involved in the clinical health sector. We also have equity in access to innovation. So let's quickly talk about the challenges facing AI's adoption in healthcare. So AI doesn't follow a holistic approach because there are psychological and social aspects of medicine that AI systems do not consider currently. I think whilst we try to develop or integrate AI into the health sector, it's very important that we pay attention to these critical issues while we develop this technology. If not, this technology will not be fully integrated because healthcare professionals will not accept them, and then we will lose patient trust, and these patients will not comply to medications. Thank you very much.